I always knew I wanted to be a surgeon. The first time I saw somebody get their voice restored during a procedure, I was hooked. I was a singer my whole life, and I've always been interested in helping people improve their voice and get their voice back. I do all of the ear, nose, and throat procedures, but my subspecialty training is in voice and swallowing problems. So I do a lot of esophageal procedures and vocal cord procedures. I think our team approach, using a voice speech pathologist and a laryngologist, which is an ENT who specializes in voice, really helps us address the very specific needs of people who use their voice to make a living. So I've had people who have come for years with problems with cough or their voice, and I feel like I've been able to help a lot of them. And so they're very grateful when they've been coughing for 30 years and we find a way to make that better for them. I tend to be a pretty straight shooter. I try to really pinpoint what's bothering them, what I can really help them with. And I have a policy of being very honest with my patients. I tell them, I'm never going to lie to you. This might be a little uncomfortable when we do this, or so that they believe me when I tell them that it is going to be okay. So I feel like we develop a very trusting relationship. We have a pretty tight-knit team here. We have our medical assistants and audiologists here who work with our patients the same day that we see them. We also have a clinic where we have a voice therapist who sees the patient the very same day. And so I think that we can offer them a very comprehensive approach, not just the medical and surgical side, but a lot of times some of the behavioral and functional things that people can do to improve. For example, if you come in for a hearing problem, you're going to get a hearing test that day, and we're going to really try to get to the bottom of what's going on. Well, one of the things I'd love for people to know is that I'm a Newport News native. I was actually born in Riverside Hospital, and my mother worked there for years. The whole philosophy of the Riverside Care Difference at its root is treating our patients like members of our family. And that's easy for me here. Again, this is my hometown. My whole family is here. I'm Rees Lintzenich with Riverside Ear, Nose, and Throat Physicians and Surgeons.